Where do you think the impetus for sustaining this moving forward will come from?
I'll speak from the regulatory point of view because I think a lot of people view the regulatory health authorities as being the slowest moving ship on this body of evidence. Um, I think where it's going to move it for the health authorities is when we present them with real world evidence and then they say, oh no, we still need the randomized controlled trial. And then the randomized controlled trial confirms what we told them 6 months ago, 9 months ago, 12 months ago. And we learn which parts we can rely on and which parts will ring true in the end, but using what they consider the gold standard of a randomized clinical trial. And we're already seeing that in COVID to Sai's point. You know, some of the early signals in the real world data really are panning out in the more controlled trials that are being conducted. And I think that's what will be helpful in particular in this coronavirus environment.
Yeah, and I think another factor to consider in this is that I think that the patient's behavior and the patient's engagement in healthcare and disease is different today in the context of COVID. You know, what we see in terms of patient engagement in providing data, for instance, and all of the apps that are out there and the numbers of patients that are joining these things, and the hunger I think that patients have for information and for ensuring that the decisions that are being made are relevant to them, I think is even greater today coming out of the pandemic. I sensed a much greater engagement across all of the stakeholders, including patients and healthcare. And I think that that's something that's going to persist as well.
Yeah, I think Dr. Gottlieb made an important point. He touched on it briefly, but the whole HL7 data standards interoperability initiative, and that there's real funding behind it right now and a real drive across industry, in part given what's happened with the pandemic, is another big driver as to why I personally think this is not just going to be a flash in the pan associated with the pandemic. This is now really going to happen. I, for one, am optimistic in that regard.
There was a lot of optimism in the roundtable. There was a lot of optimism from both Dr. Gottlieb and all the participants actually. So that also, I guess, helps with the momentum, right? You keep that going.